This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
Neuropathy. You may have heard the word before. If you're dealing with it, you know the word very well. Maybe you know somebody who is challenged by it, debilitating, impedes movement, painful. We are going to talk about that today and a lot more with somebody who is going to help you with your path to wellness. And that's the name of her center in Tulsa, Oklahoma. She's back with us. She runs deep when it comes to acupuncture, hypnotherapy, many different modalities. And she's also an RN. She is Teresa Wilkinson. She's back on the program with us. How are you doing today?
Oh, I'm doing fantastic. And
So,
I'm also a doctor of Oriental medicine, just so you know. But I was looking up some different doctors speaking on um, lowering cholesterol last week. We talked about that, which goes into the neuropathy factor because some of the medications for blood pressure, um, high cholesterol, will cause the neuropathy. Also, surgical things can cause neuropathy, like a double mastectomy. So, a lot of women have to wear compression sleeves to go fly in an airplane because of the compression. And I'll talk more about that microcirculation factor. But in
well,
talking,
why
in
don't we
hearing,
define, how about we define neuropathy?
okay,
Just
neuropathy refers to damage or dysfunction of one or more nerves. Now, what it does, it starts deteriorating the myelin sheath, which covers the nerve. And that goes from the brain all the way down to the extremities. It can lead to pain, tingling, numbness, muscle weakness, cramps, restless legs. Um, and so we want to, it can be burning, sharp pain, sensitive to touch. It can be complete numbness. I had a
hmm.
lady that came in with neuropathy. She wasn't managing her diabetes. She was taller, bigger than me, and we hugged because she'd been a long time client. Then she starts stumbling backwards. She grabs me by the back of the neck. She takes me down. It ends up ripping. It fractures my pelvis, fractures my sacrum,
What?
rips my hamstrings, rips the inner pelvic muscles. It rips my hamstrings off my pelvis. It rips the hamstrings off the back of the knee, and it caused me to supposedly have two knee replacements, but I've avoided it using some laparoscopic knee surgery and doing all the modalities that I
Whoa,
do.
whoa,
So
whoa,
it
whoa,
it
whoa, whoa.
completely ruined my life for a year and 9 months, and I'm still overcoming. I haven't been able to ride my horses in 2 years. Now, this is a lady with neuropathy. She came in because she had numbness from the knees down, starts stumbling backwards, grabs me by the back of the neck, and they said the doctor said the force of taking me down without me, you know, on my own going down to the floor caused all that to happen. Now,
I'm
the the
blown away, Teresa. I had no
uh,
idea.
the therapist thought a fire alarm went off. I screamed so loud, but I worked with a walker. I had a walker at home and a walker here, and I just kept working. But anyway, let's get back to this lowering cholesterol. So, in talking to people about getting off their statins, one thing a fellow said is, I go into a deep depression when I've tried to get off them because my cholesterol's fine now and he eats a good diet. And so this is the deal. And then when I listened to other doctors speak about this, they said all this came about back in the late 70s, early 80s when they started ordering statins, when statins became a thing. And guess what else started happening? Dementia, Alzheimer's, autism. It starts affecting your brain. So guess what your brain is made of? So I had a paramedic that was over in the Afghanistan war, and he was in the operating area. They were doing a autopsy, and they had the brain. It was a brain injury, so he had the brain in a bowl, and he said the brain was like a big bowl of fat. And so if you look at what the brain, we can talk about that in another podcast, but it's surrounded by a fat layer to protect it. Plus, the fat protects the myelin sheaths of the nerve endings. And so the limbic system, the cerebrum, all have to do with mood and emotion and connecting with your body and movement. And so that tied into him having this issue with going into a depression. And so I looked it up, like, how can this happen? If so, going off of statins in this case, and it may be a good idea for anyone, changing up their diet, changing up their lifestyle. Maybe they're just on the border and they can try to make a shift of, it can cause inflammation in the brain by going off your statins, and some people that are, he's already on an antidepressant. So whenever you try to get off an antidepressant, you have to do it slowly. So I'm going to suggest, if you are in between your doctor's appointments and you're trying to change your lifestyle and diet, and you're wanting to try to get off your statins before your next blood work, do it slowly. Maybe take half at a time, do every other day. Work your way off of it, because it can cause some inflammation of the brain, because that's where our cholesterol is. Our cholesterol is there for a reason. It makes our corticosteroids. It helps with our memory. It helps our brain work. It's a precursors for our hormones and our brain function, which controls the rest of our body, our central nervous system.
Wow.
So I just wanted to add that, because we talked about, okay, getting off these things, but we got to be careful. If we're going to try to do it, let's do it slowly. Let's be prepared for our next doctor visit with our blood work to see if we can show that we've, and then the supplements we talked about. But what I wanted to say, well, I get at least 2 or 3 people a week with neuropathy. And a lot of times it can, believe it or not, I get people maybe twice a week with MS. MS is common. People that get Lyme disease. Okay, so infections, shingles. So I traced back MS and lupus and some of this. And so it's in the same family. We talked about Bell's palsy before. It's in the same family of shingles, herpes, Epstein-Barr virus, Lyme disease. But if you take that back another step, back generationally, it goes back to chickenpox. So that virus of chickenpox, we carry in our DNA, even though we do get vaccinated. But it can, if you're under stressors, cause a flare-up. And the other thing that's interesting, it goes back to the brain again, and what happens when we're sleeping. Okay, in the day, we're in autonomic nervous system. We're go, 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 make every minute count, and then sympathetic nervous system. When we're sleeping, ideally we go into a parasympathetic nervous system. And believe it or not, our exchange of oxygen uses up calories. I don't know if you've ever weighed yourself the night before and then you weigh yourself the next morning and you've lost about 3 pounds. The liver is processing that cholesterol, the fatties, our food, the kidneys are processing. We might pee in the night. We might have to get up and pee first thing in the morning. And a lot of that fluid, we will be losing weight. So oxygen exchange actually takes up calories. Our liver working is metabolizing and resetting our body and our brain, and then our kidneys are working. So it's very important that we get that rest. Well, what happens when we go into a parasympathetic nervous system? All these people that have this neuropathy, restless legs, muscle cramps, all this pain, it happens when the sun goes down, and then it subsides when the sun comes up. They
I wanna
suffer at
confirm what
nighttime.
you
They
just
suffer
said.
at nighttime.
No, I hear that clear? And I'm trying to view a friend of mine who has neuropathy from diabetes. You're saying that it affects you most at night?
That's what That's what my patients are telling me. Now,
Interesting.
neuropathy from diabetes may be 24/7 because those nerves, you've got arteriosclerosis to the nerves to your legs, just like the lady walking in. She was okay. She drove here from out of town, got into the clinic, walked in, fine, hugged, and then all of a sudden she starts stumbling backwards, grabs me by the back of the neck and takes me down. Now, I break her fall, thank God. She does not hit her head, thank God. So uh, I saved her, but it destroyed me. Um, anyway, that neuropathy, people need to really be careful. So this is another example. I had a man, he's an actor. He came in a walker, and I said, "What's going on with you?" And I think he was wearing house shoes or something. His feet were gigantic. I had just worked on a lady and she'd been on vacation. I said, "How was your vacation?" And she said, "I was bedridden the whole vacation." I said, "What was the deal?" She goes, "Well, my doctor put me on a new high blood pressure medicine. My feet swelled up to this, and I couldn't walk." And so I said, "Well, did you look up the side effects?" "Yeah, my husband's real good about looking that stuff up." "Did you call your doctor and get switched on your medication?" She said, "Yes, I did. And see, my feet are now back to normal." I said, "Great." Well, right when she's leaving, this other guy comes in, can barely walk. I said, "What's going on with you?" He said, "Well, it's all working out because I was in a film being a disabled veteran and I didn't have to act. It was real." so so anyway, I got him on the table. I elevated his legs and feet. And while I was checking her out, I said, "Would you come in here?" I said, "What's happened to you?" He says, "Well, I got it on a new high blood pressure medicine." I said, "You're kidding me." So I brought her in. I said, "Look at his feet. Is that what yours look like?" She goes, "Yeah." I said, were you on that caused your feet to swell?" I said, "Tell him, is this what you got put on just 2 weeks ago?" And he says, "Yeah, that's it." I said, "Call your doctor and change your high blood pressure medicine. Your body isn't working with this well." I measured his feet. They were 18 inches around. I got him down to 11 inches. So what I used is an herbal wrap with green tea and guarana. I did acupuncture. Of course, after I did everything I could, I massaged the fluid out. I used it's a German device called a beamer. It stands for bioelectromagnetic energy regulation. It's identical to our frequency in our body and of the earth. So 24% of our circulation is in our arteries and veins. 76% of our circulation is cell to cell. So a lot of this stuff gets cellular. Okay. So also I did some red light laser. Um, and then I'm trying to think what else. Oh, we have a new device that actually does a pumping action. A lot of times they put it on you after surgery to make sure you don't get any blood clots through surgery after post-op. But I took his feet from the 18 inches down to 11 inches in 1 hour doing all my modalities.
Wow.
And then he could walk out. Then he got on a different high blood pressure medicine, and then he went back to normal with his feet. So uh, that was like shocking to see his feet like that. But anyway, I had a lady the other day that came in and she couldn't walk. She was actually completely bent over and was shuffling. And her story was kind of odd, but we traced it back to the chicken pox, but nobody could diagnose her. The only thing that happened is a train wrecked when she was a little kid and it dumped out all this corn. It was on her grandfather's land. So he said, "Let's build some silos, gather this corn, shouldn't go to waste." She was in these silos swimming in the corn. And she was playing and having so much fun. She said she could actually swim through the corn. And her grandmother looked over the edge. She goes, "Where are you?" She goes, "There's snakes in there. Get out of there."
Ah,
I asked my husband, I said, he's a snake guy. So I said, "Could there actually be, would snakes eat corn?" He goes, "No, but they would eat the mice that are in the corn."
oh, and isn't not that there's a connection, but isn't there a corn snake? It's called a corn snake. I don't know if it eats
I,
corn, Well, that name.
It's probably because it goes in there after the mice that are eating the corn. But anyway, it took her till 50 years old. She had a setback again through some stress in her life. Her husband died cutting a tree down. It hit him right in the middle of his forehead, killed him instantly. It completely put her in a shock. She got to where she could walk. And so she tried, went to all these different doctors. She did her own research, found out that there was a fungus on corn, that's natural. Just so, like, if we look into this
Wow.
MS, shingles, Lyme disease, HIV, all this stuff, there's some kind of a fungus, virus, bacteria, something. And she had to pay a lot of money for a test. This is, I don't know, 20 years ago, and it turned out positive. Well, I traced it back in my research to the chicken pox, the same category as shingles, herpes, Bell's palsy, all that. And anyway, she said, "No, I will be jerking around just like restless legs. When you're working on me, my whole body will be jerking around because it's caused my brain to affect all the nerves in my body." And so she did. She jerked around through the whole thing. But I did my treatment on her. I did all the things I was telling you earlier with acupuncture, massage, the beamer. And when she walked out, she was standing straight up. She was walking better. And we went through a protocol for her. She goes, I want to heal my myelin sheath of my nerves, from my brain down to my uh, uh, extremities. She says, if I fast for 5 days and then take some detoxing supplements, that Z-Lite's one of them, and you can take oregano's a natural antibiotic, royal jelly, bee pollen we've talked about. And then I take these things that help me detox. Then if I take stem cell therapy, where we have patches to help with detoxification of muscles, helping muscle respond better after workout. We have stem cell patches. What they do is they don't instill anything in your body, they activate your dormant stem cells. And it's through peptides. It's through copper peptides. Copper transmits electricity, going back to our frequency again. Peptides are your amino acids, are rebuilders. And so a lot of bodybuilders use different kinds of peptides when they injure themselves, androids. Going back to why cholesterol is so important, it's a precursor for all those things to heal our bodies and make our bodies work properly. But anyway, it said, yes, you're onto something. If you do that and you detox your myelin sheaths, because they're shredded, they'll come off in pieces, and you detox them, eliminate them, then you rebuild them. You will rebuild and heal yourself from this problem. And so it's now been a 10-year problem, but her legs were real stiff. Her knees would not bend. And so I got her knees bending and her legs working. And she walked out here straight up. Before, she was completely bent over, like all the way in like a L shape, where her body was over and then shuffling. In one treatment, 1 hour, I had her standing up, walking better. Now, if she starts working on this protocol, so she's on disability, so she's going to have to get her finances figured out, how she can get the products and do it. But it's about $100 a month for the stem cell. So they don't call it stem cell because it's activating your own stem cell. So it's not literally stem cell. Now, I did do stem cell injection for my knees after that episode I had, and they actually harvest it out of the largest flat bone of your body, which is your sacrum, which had been fractured. So that didn't do me any favors. I actually used a hammer and an ice pick to go in and make a hole in your sacrum that they can extract the bone marrow, and they mix that with placenta and spin that for about 15 minutes and then re-inject it, and that's your true stem cells.
Oh
There's
my gosh. This podcast has gone in like many different directions of insight. Unbelievable. We are almost out of time. Quick questions. I think we're going to have to pick up from where we left off here. Detox. You mentioned that with that woman, maybe made some changes for 5 days before she went on to a different treatment course. Detox important? What do you
Yeah,
think?
because we get toxins through our water, medications, chemotherapy. There's heavy metals in our water. We can
Mm.
we can filter it all you can, but like when I found out I was allergic to some of the metal they put in my neck, I had a real bogus neck surgery. I was supposed to just get a disc replacement because I'd broken my neck falling off a cliff when I was younger. But the guy, once I went into surgery, talked my husband into putting 10 levels of rods in my back that I did not need. It turns out I was allergic to the titanium. They wouldn't believe me. But anyway, I did a hair test and I could not believe the heavy metals in my hair. And I've used water purification for over 50 years.
Wow.
So we're absorbing this stuff through, and it's also in the soil. These farmers are soil testing and saying it's increasing in the
We should do a whole
soil.
podcast on toxins alone when you think about that, and microplastics. Oh my God. I mean, I hear we consume a credit card a week in terms of the microplastics if you put it all together. I don't know how accurate that is, but even if it was a month, it shouldn't be in your body. Teresa, how do we find you? What's the best way? Somebody's got some questions. You've got some very revolutionary tested techniques to help people. But even the old school stuff is amazing. Some of the things you've explained that people don't do anymore, maybe, but it works. How do we find you?
Okay, so I'm here in Tulsa, Oklahoma. Clinic is the Path to Wellness. I do acupuncture, massage, different medical spa treatments like detox foot baths, these herbal wraps, different facials, waxing. We have lasers. But anyway, you can find me on Path to Wellness, Tulsa, Oklahoma website or tulsapath.com. And then you can also message me on Facebook, and I'm here to help.
Unbelievable. Thank you for today. Thank you for sharing your journey. My head is still spinning from what you went through helping a patient. But you, at your expense, you saved that patient from even more challenges. Just unbelievable. You're amazing. You're like, superwoman. It's unbelievable. Thank you so much for today. Truly appreciate it.
Okay, it was
Good
great.
stuff.
Thanks.
All right,
Okay,
we'll
all
talk
right,
soon.
bye.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.